Good afternoon, and welcome to the Great Lakes Health Program. In our new time slot, I know it's a new year, but I just want to make sure everybody is aware of the new time slot, 1 until 1:30 p.m. I am your host, Francesca Messiah from Kaleida Health. At Kaleida, we see people, not just patients. Our topic for today, we are going to be discussing health as well as education. The two go hand in hand. And it's an organization, a not-for-profit organization, that has been affiliated with Kaleida Health for many years. And the name of that organization is the Near East and West Side Task Force, commonly known as NEWS. Near East, West Side spells news. And that's what we're about, sharing good news. Our guests for today are three of our current board members of the News Task Force, and that's Esmerelda Sierra.
Hello.
Esmeralda's was with Units.
Yes.
Valerie Rosenhoch. Good
Hi.
afternoon, Val.
Hello.
And Val is recently retired, not slowed down, but recently retired from Univera Healthcare. And we have the one and only dynamic Kim Walek from Parent Network. Good afternoon, Kim.
Hello and good morning. Afternoon now.
How are you? Well, we're just going to begin because we have a lot of information to share. Val has been with the task force the longest, so I'm just going to ask Val if she could give a summary of what is the Near East and West Side Task Force. What is news and how did it come about?
I think it came about by people being concerned about what the health care and education needs were in minority communities in Buffalo. And the News Task Force is really a combination of two groups that had formed at the grassroots level. Mm-hmm. There was one on the west side, the Hispanics, Western New York Hispanics and Friends Civic Association, and it formed around 2003. And then there was the Near East Side Health Task Force, which formed on the on the east side in 2001. And they both, I believe, came out of studies and concerns among people as to what was really happening. Both task forces were going along well on their own, but then decided that this was really a citywide issue. And there may be some differences among minority groups, but many of the concerns were the same, and so then we merged around 2007.
That's fascinating. And I'm going to ask everyone this question. Why is it important for the news to continue providing community outreach? There's so many times I've been on committees where people have said it's not important anymore. And I know I can't speak for you, but you're all board members and you're all passionate about what you do on the board. And I know there's a reason that something that keeps you coming to meetings, our board meetings are at 7:30 in the morning, our regular meetings at 8. So my question is, what is it that you feel is one of the most important reasons to continue providing community outreach to communities of poverty in the east side and west side?
Okay. Well, I have to say that one of the main reasons is transportation. Not everyone is able to move around the city, especially during the winter months. So what we do, we come to them, we provide to them, we go to where they work, where they live, and we provide them with the information that they need, the resources that they so much need. Mm-hmm. And we have information for all ages, from programs for children to programs to senior services. So we want to make sure that the families get the information where they live, and also that way we provide the resources that are around them in their area, so they don't have to go a ways to find the services and help they need.
And Kim?
I think Esmeralda really highlighted the grassroots piece, which is what really keeps me involved. You don't want to just, I think this is what this community needs. You want to hear from the community what their concerns are. And I think news really takes to heart hearing what the community is interested in, trying to get that information out so that everybody's aware. And what keeps me involved is there's a lot of information out there, so much that you don't know all the different pieces. So getting the chance to hear, interact, talk to other agencies, get out and meet individuals in the community to hear what their concerns are and what information they want or don't think is out there, but you can help link them up with, it was really important to me. I want to see Buffalo continue rising and everybody doing well.
Thank you. And Val?
I think one of the areas that we put a lot of emphasis on was getting information to people about health insurance. And so as the Affordable Care Act was ramping up, we were very active in bringing the information to people and continuing to keep them informed about how the health exchange works, the new health essential plan worked, and because without insurance, it's very difficult for them to access health care. And insurance, of course, includes Medicaid, which many residents of both the lower west side and the east side benefit from. And I see this something as an area that we'll continue to be involved in as changes take place in the program.
Yes, and the health insurance is changing every day as we speak.
Right.
Yes,
Every
it is.
day. I understand that the News is a membership organization, and Val, I know you've been, all of us, but Val, you've been very active in the structure. And in terms of, we have members, we're going to talk a bit about members, but I just first want to talk about the structure, because we are a 501c3. We didn't start off, and I say we because I am the executive director of the Near East and West Side Task Force. Collide has always supported this initiative. And so when the task force first began, both on the west side and the east side, it was not a not-for-profit. We've gone through a process. Val, could you just highlight a little bit about the structure?
Yes.
The membership and the structure?
We are a membership organization, and members represent really three different groups. There are institutional members who are at the highest level. That's a $300 membership. We have community organizations because we recognize that there are groups that want to be involved and can contribute, and they give it a $100 level. We have supporting members, individuals who are at a $25 membership, and it's really, the idea is to have all of us come together to talk about what the issues are and what are possible solutions.
And I know during the last meeting we had a very, I don't want to talk, we had an interesting conversation about all of our members. Can someone just touch on some of our different members that we have?
Yes, we do. We have a huge array of members. We have from hospitals, community service organizations, we have community groups, and as well said, we have individuals. We can mention some of them. For example, Kaleda, of course, is a member. We have others like ECMC units. We have UB Smile Team. They are part. Parent Network is also part right now. And we have had many past organizations that what they do is not just only bring to the table the information, but also help us grow and get out there. Just to mention some of them, Black Leadership Forum, Catholic Health, we have Child and Family Services, Roswell Park, Community Health, Community Health Workers, Community Health Center, Community Health Workers, Network, Givon. There's so many, and we always have room to grow. So if anybody's interested, please consider joining, because you're gonna receive many benefits from being a part of the news.
And I was going to add, I thought one of the really vibrant things that happened with our meeting last time was sharing among all these different members and supporting agencies to see, are there ways we can work together? Or this is what we're doing. I didn't know you were doing that piece. How can we get that information out? So there's different committees that are involved with news as well. And the one that I'm most familiar with is the Health and Education Committee, really trying to look at, you want to educate people so that they're healthier. And if you have good health, then the education is easier as well. So it sort of became the wedded committee, and how do we help educate and inform individuals on ways to improve their health. So I thought it was a dynamic meeting because we were sharing and looking at different ways to get information out there and also to work together so that more people know how to help themselves or how to help their children.
Exactly.
And I just want to also mention another member we've had. There's still a member, Juville College, and with Juville College, what they've done, and how they've looked at what they've done with the task force, they have worked within some of our senior citizen centers on the east side and on the lower west side, and they've done fall prevention studies. So I just want, so in terms of how organizations, not only do we collaborate at wellness and health fairs, but also it's an opportunity for your organization to tap into a network that you're struggling, and all these people are at the table. We're there to help each other. And Univera Healthcare, I can't forget Univera. We have a dynamic speaker that about every year comes and gives almost an hour and a half presentation to inform us of what's taking place in the world of health insurance.
Right.
Yeah. For additional information, I'm just going to give you a phone number, listeners, and that number is, for additional information, please call 859-8045. Again, that's 859-8045. Oh, and one other organization, the Healthcare Education Project of 1199 SEIU. Can we talk about some of the highlights of 2016? I know it's like 60 degrees outside. It feels like it's April. It's really January. So could you share with our listeners some of the highlights of 2016?
Well, I would say one of the big things that Near East Side West Side Task Force helped to pull together is our Passport to Wellness events. And so we had 4 sponsored events last year, one at the Broadway Market, one at the City Court building. We also had one at the Tops on Jefferson, and I know we're in the works right now trying to get a new Passport to Wellness event set up at the Family Court building sometime in the next upcoming months, so keep aware.
And for our listeners who don't know what that is, does it mean you go over here and get a passport from the passport office? What does a Passport to Wellness mean?
Well, it's looking sort of at that passport idea. Individuals would come into the event.
It's a free program.
It's a free program. You come in. There's a number of different tables with information being shared. The passport's actually a sheet of paper that says, oh, you want to visit units and find out what units is doing in the public. Oh, you want to see what does Parent Network help with in regards to children that have special needs and needing services. Or, I see that the Clyde is here helping out with blood pressure screening, so I want to do that. What the passport does is it really helps individuals to visit all these different tables, and if you've gone and visited the majority of the tables, you now are more informed about ways to help your community and how to help yourself. And what we really hope is with the information you have, you'll turn and share that with other community members. But as a thank you for going and visiting at all these tables, learning this great information, finding out more about yourself and how to help others, there's a nice little incentive, usually a gift card to an area market. TOPS has been a wonderful sponsor of this event in the past. And so that's something to look forward to when we have our wellness event, getting your passport and getting a gift card, but also helping your community by sharing the information you learned at this event with others.
And I just want to add that also last time Millennium Collaborative Care also donated gift cards. So yes, the Near East and West Side Task Force donates gift cards, but we don't discourage our member organizations if they want to. Val, do you want to talk a little about Passport to Wellness?
Well, it lets people see what's happening with their own health. The blood pressure screening. They can talk about weight control. There's information from the Kidney Foundation participates, the Alzheimer's Association.
Bone density we've had.
Or you can sign up for a doctor.
Right,
Yes.
and that's a really significant piece, because if you don't have a doctor when you are sick or when you think you're getting sick, you may wait too long, and you may end up in the emergency room, which is not the best place to go when you could be taken care of earlier on in an illness.
And also, in addition to having information about health and different testing, we also provide information about other services that are available in the community. For example, being part of the education team, we have the Parent Network, and I will never forget how many times people come and they have no idea that they have these services available for their children with special needs, and they were so grateful for having, not just being able to know that their blood pressure was fine, but also that now they can get the help they need. So it's not just about being healthy. So if you're a healthy person, come on, show up. You never know what kind of services you can learn about that can be helpful for you or your family, or even someone that you know that might might need some kind of service.
Or if you're not healthy, show up.
Oh, most
Because
definitely.
you can
Those are
definitely,
the
by
ones.
the time you leave,
Yes.
and that's how you get the gift card. You have to have a conversation. It doesn't have to be a long conversation, but I know normally I'm registering people in and providing the gift card, and I always do a brief survey of all of our participants, like 75 people. Just tell me in one sentence, what did you get out of it? And normally it'll go on for 4 or 5 sentences because they never thought that they would have gotten that much out of meeting with all these different individuals. And if it's at the Broadway Market, we have organizations from the Lower West Side. We have businesses or not-for-profits from the East Side.
Exactly.
Or South Buffalo. So we have a wealth of organizations whose primary target is health and education of people in need.
In this specific area. So
this
we try to
specific
get
area.
the providers from the area. So if you live in the west side, you would try to look at a provider from that area, so you can even find it at walking distance. So you don't have to worry about going.
Right. Transportation. You said it.
Exactly.
And on occasion, we've identified somebody who is in serious trouble,
Oh, we have.
who
Yes.
has gone right
that's
in
right.
Yes,
for
yes.
services.
We have had more than one occasion
Yes.
an ambulance come
Right.
because a person's been that ill.
Mm-hmm.
Yeah, but we find it there. Health and education. You have great meetings, and you're high tech now. Kim Walek, our chair of the Health and Education Committee. Could you just share a little bit about what makes it such a success? What makes your meeting so successful?
If you're going to go high tech, I guess that's efficient electronic minutes that
Yes.
go out. And that.
And people call in.
And people
And
call
people
in.
call in, so we do have those
And-
meetings. You don't have to face now. You can actually call in to
And you-
attend and still
you have
get
it
to
down,
share
And you
information.
have it down to 60 minutes or under.
Yeah, we've gotten very efficient with our meeting minutes, but the great thing is we're passing on information about how we can work together, getting ideas of maybe what's the next place that we can get information out or that we've heard that the community is concerned about, and then turn that into action steps. Because we're hearing a lot of concerns here, let's try and do an outreach event, and who's got connections, and sometimes that's how we can link in with a neighborhood church or link into an activity that's happening at a school because somebody shares that, our spaghetti dinner is going to be held that night, and so we'll have a lot of families there. Maybe you can team up with us and have information from your news members. So just a
Courthouse
lot of
could
good networking on sites to go to. To tie into that, right now our committee's looking at what would be a topic that the community is really interested in that we can bring individuals in to then share that information. So when the Affordable Health Care Act first happened and it was a mystery, nobody knew exactly how that was going to look, news went and talked among our members who would be the best person to share information on what we know at this moment, and let's get that information out to the public so that they have a better idea of what's coming down the pike. So we're doing the same thing right now. What would be good information that individuals want to learn about so that we can do that due diligence and try and find somebody that can share information so that you don't feel like you have no idea what's happening. You have some understanding of what's coming on, and you can tie into that conversation of what is important for my community and what I want to see so that things don't just happen to us. We can help proactively sort of shape what we need.
Proactive. Esmeralda, I know we're running out of time. Could you just talk about some of the collaborations that have happened on the west side with news?
Yes, actually, we every year during the spring we have a really successful health fair and a passport to health event at Tops Niagara Street, which is very welcome. Not just by the supermarket but also by the community. Sometimes we don't have enough time. So sometimes the time is over and people still walking in because they really want the information. They need the information. In addition to that, we have worked with the Hispanic Heritage Council, and they do a kickoff in September at the downtown library, which is pretty close to the west side. So a lot of people from the west side take part of this event, and News has been there also providing the different vendors for the health fair so people can learn and get information that they need. So those are two of the main ones that we have done on the west side, but we're trying to reach out more. We want to create more partnerships. So if anybody's interested, please contact us. And also, I wanted to say that on the membership, if you really, as an individual, are interested in continued learning, please join us, because every month we have a different speaker in our meetings, and it's a speaker that will benefit the people from the east side, from the west side, from the whole Buffalo area. So I think if you live in Buffalo anywhere, please consider joining our events and even joining our task force, so you can learn and also share or even help us create more events too.
Yeah, and along that line, I know some of our speakers, I'm just going to mention a couple. Assembly Member Crystal People-Stokes. We've had the City of Buffalo, Citizen Services come. We've had the Board of Education, representatives, UB Medical Step. So again, we try to have both health and education speakers. Also, we forgot to talk about Clean Sweep, working along with the City of Buffalo on Clean Sweep, and we definitely look forward to working with them again. And that's from April to almost October, going door to door. Several of our member organizations participate in Clean Sweeps. Before we run out of time, we have like 2 minutes left. Again, I'm going to give you the phone number, and the phone number to call for more information is 716-859-8045. 716-859-8045. Ladies, could you just share a little bit what's on the horizon for 2017 for Task Force, some of the things?
Well, you mentioned the Clean Sweep. So as the Clean Sweep does happen across the city of Buffalo, I would ask people, take a look at what's inside that packet of information. It's a lot of good information about city services, but also agency services. And there's usually a flyer in there that talks a little bit about the Near East West Side Task Force in English and in Spanish, to give you a little bit more information about what we do.
Yes, and we are looking forward to continue doing the passports. For this year, we are working on 4 different events in both areas, East and West Side. So be on the look for those ones. And we want to bring more members so we can grow and keep doing great things for the community in 2017.
And I think we also will work to inform the community about what is happening to change the access to health insurance as the federal government looks at making changes, and then how is New York State going to react to that?
Okay. And I know I just also want to add that in 2016, we supported, the New York East and West Side Task Force supported over 50 health fairs in targeted neighborhoods with our member organizations. Those are the members of the New York East and West Side Task Force. We have collaborated with numerous local health and education organizations and projects. We have helped support grants with letters of support. I mean, so when you join, and this organization has been around, 16 years? 17? So we've been around a long time. We're small and mighty.
Yes.
And you can tell right here from listening. Well, ladies, I want to thank you. I want to thank Valerie Rosenhoch. I want to thank Esmerelda Sierra. I want to thank Kim Walek. I also want to mention that our meetings are on the second Tuesday of each month, 8 o'clock at Units.
110 Broadway Avenue.
Broadway
It's
Avenue.
really easy. It's between Elm and Oak.
Yeah, it's a block from Waffle.
Yes.
Right. So I want to thank you, ladies. Thank you so much. Thank you for being on the board of directors. Announcements, January 24th, that's tomorrow. Kaleida Health will be at UB EOC from 11 in the morning until 1 in the afternoon. And God be willing, I will see you in 2 weeks. Our topic for the month of February, we'll be talking a lot about urology and cancer care. So in 2 weeks, we'll be hearing that topic. Next week, you'll hear my colleague from ECMC, and she will be here to speak with you. I'm your host, Francesca Messiah from Kaleida Health, where we see people and not just patients. Bye-bye.